In the previous vaccine releases, the doses were ordered and paid for by the federal government. Now pharmacies are footing the bill and relying on insurance companies to cover those costs.
Inside the Skip Back Pharmacy in Montgomery County, the lines have been long.
And a few hundred doses a day just here at the pharmacy.
Once the provider learned a new booster was on the verge of approval, the customers were surveyed if they wanted the doses.
And now you have that load of people walking into the pharmacy for vaccines, as well as those appointments. And if you don't manage it correctly, what's happening at some of the chains is actually people are making appointments, walking in to get their vaccine, and then they're notified that, sorry, we don't have the vaccine in stock.
And while keeping up with demand has been tricky, Dr. Mack says that's because this time around, pharmacies are picking up the tab. With prior rollouts, the federal government ordered those doses and supplied them to providers or to the state. Now it's direct to provider, the chains, and local pharmacies like Skip Back.
Now we actually have to pay for the vaccines pretty much when we buy it, and the cost of the vaccine is over $120 per dose.
Insurance companies are required to be picking up the costs, but those claim forms haven't been coded, leaving some patients turned away.
We have a patient that had an appointment, walk into our pharmacy. We don't have the vaccines left, so we had to cancel the appointment. Do you guys have the vaccines in stock? And I said, yes, we do. Send them over. We'll take care of them.
Dr. Mack gave the dose and is hoping once insurance glitches are fixed, he'll be reimbursed.
If someone's insurance doesn't cover it, we still want to be able to help them out, because that's the whole point of this. The vaccine is the more people are vaccinated, the better we all are.
Now, those non-payments or underpayments are affecting providers differently. Big chains, he says, have turned folks away. Health plans are required to cover the doses under the Affordable Care Act, and many have alerted the Department of Health and Human Services. It is working on these technical errors to cover those costs. In the newsroom, Deanna Durante, NBC10 News.